Hi, welcome to Holistic Aging. Come on in and I'll show you around. So we have two types of assessments that we conduct here. They're typically conducted by a RN life care manager, and it's the determination of which assessment you use is purely dependent on what the personal needs of the client are. So the two types we have are we do a life care plan or an emergent assessment. I'll tell you how to differentiate the two in a moment. So the emergent assessment we conduct when it is the family feels an urgent need to use our services, our life care management services. An example of how you might use that is your family member is in the hospital. They have immediate needs to be discharged, and you don't know, the case manager in the hospital told you, and they have to be discharged tomorrow and they can't go home. So we come in and we assess the situation, take a look at the medical records, the chart, talk with the practitioners, and determine where you should be going. An assessment like that, the determination, the need for an assessment like that is, one, it's an urgent need. Secondly, you want it done quickly. So our life care plan takes a 2-week process for that to happen. When you have an emergent need for our services, we will do an emergent assessment when the need is of immediate nature. And the other thing is you really don't want to wait 2 weeks for the report that's involved in the life care plan. We will typically recommend to you, after having a short conversation with you, whether you should choose the emergent or the life care plan. So the nuts and bolts of our assessment is truly the life care plan, and that's what we recommend unless it's a crisis situation and you need us immediately. So when we are doing a life care plan, which is a fixed rate for that assessment, we look at several different areas. One of the areas we would look at is the appropriate living environment. Are you living in the most appropriate place? Are you, if you are, how can we make that be the safest? What can we do to bring in services that would make it be the safest and the best place for you to live? If when we're doing the assessment we determine there's a reason why living in your current environment is not in your best interest, then we can offer recommendations on places that we have vetted that would be specific to whatever your personal needs are. So we take a look at the whole environment, make sure it's a safe place, the best place, and we're going to project into the future what your needs are. So maybe initially the home is the best place, but based on what your diagnosis or what your needs are, maybe 3 years down the road, we may project that you may need services in a personal care home, and we're going to recommend which one at that time. And that's kind of these are all in a nutshell. The second area we look at is the disease that you have. So we look at it from a holistic perspective. So we're not just looking at managing and helping you manage the complex chronic conditions an older person may have, but the way you can age well with that, meaning we're going to look at what you can do versus what you can't do and optimize that. One way we do that is we take a look at all the medications that you're on, and we're frequently able to work with your doctor and get you off a large number of medications that really aren't recommended for the geriatric population, or sometimes for any population. So we do, along with the medications, another area we look at is how are you distributing and getting your medications. We find at least 3/4 of the population that we do assessments on really aren't taking their medications the way that they were prescribed. So we take a look at that and we offer recommendations on that. Another thing that we do, as part of our assessment is look at your practitioners that are involved in your care. Are you happy with the services of the doctor and other practitioners? If you aren't, we have a slew of practitioners that we work with in the Pittsburgh area that we could highly recommend. So that's another service that we would offer in the life care plan, is looking at them. We also look at all the financial and legal things that need to be in place as you age. And and we're offering our recommendations based on what you're telling us is your financial plan of how you want to use your money. So our recommendations for someone who is lower income, what we will try to do is we're going to try to pull in all the entitlement programs that you could possibly qualify for. We want to make sure that your money, and work with an elder law attorney or a financial planner, and make sure that the money you have is used to, no matter what level your income is used to your best needs as each individual person and as a family. What plays into that a lot is a lot of our clients have some type of memory disorder, and we've really become experts in managing all the varying types of memory disorders. We frequently may be the first person to be offering a concrete diagnosis of exactly what memory disorder that the person may have, because the way you treat and the long-term plan for Alzheimer's versus Lewy body dementia versus frontal temporal dementia versus Parkinson's, all the different varying types is very different. Your long-term plan and how it's managed is very different. Again, we do pull in part of our plan when we do a life care plan is we're pulling in all the local resources that we can use to support our services being involved, and we'll offer recommendations on how we can pull those in. And one of the things that we most frequently see when families call us is near the end of the conversation, they'll tell us, well, my family has some dynamics to them you need to be aware of. So our saying is there are no functional families. We all, including my own and all my staff, we all have issues that our family has brought to the table from a young time. And it sometimes makes it difficult for children themselves, adult children, to be making these determinations for their parents. So when you pull us in as an expert, we work with those family dynamics. It's just part of what we do. It's natural for us. Don't worry. Your case will not be anything different than all the ones that we've had. We try to pull in what everyone's strengths are, and then you can get things moving along much quicker when you have an expert guiding and directing the family as an entire unit. And then the very last component that we offer when we're doing a life care plan is we have a holistic approach. So we're going to look at the person's whole mind, body, and spirit, each individual aging person, and how we can optimize each part of them. We don't separate the body from the mind, from the spirit of the person. So when if the client is interested, we have alternative therapies that we can offer in our office, or we could come to the home. Some of those are acupuncture. We have a functional medicine physician that consults with us on clients, works out of our office, and we use aromatherapy for a lot of our clients with cognitive disorders. We use herbs, and this is all if families are interested. And so it's a component that we're trying to help people to move away from the disease management to a wellness management. So when we offer a life care plan, after we come in and we do this physical assessment in the home, we then write up a document. It's typically about 20 pages, and it's going to say, okay, here's the information the family gave us, that how they're seeing the situation. Then when we do the assessment, how we are seeing it, and then customized recommendations, pulling that all together, getting input from the aging family members, what they want out of our services. And then in this plan, we're projecting into the future what the needs would be. So the best part about our life care plan is we're gathering all this information and formulating it into a document that we email out to whoever our contact is, and they can share it with whoever they would like. And then we come together as a unit. So we either have a meeting in our office or a telephone conversation with, or we could Skype with every member of the family that you would like to be involved. That way we are all discussing all together as a unit our recommendations. Every family member can have some input into how they would like to see us help in the future, what things they would like to take on and do, and then what we do is mutually together we develop a concrete plan that will lead us into the future on how we could help your parent, or sometimes families may just hire us to do an assessment, and they're going to take over the management of the care, just initially getting our input into it. So I hope this has helped you understand what an assessment involves, and looking forward to helping you and your family to age well.